Recently, the resident district commissioner for Soroti City, Peter Park, was in the news for demanding that all those seeking services from his office had to present a card indicating that they had been vaccinated against COVID-19. Today, Health Minister Ruth Aceng is making a similar request, while insisting vaccination against COVID-19 is not mandatory.
Vaccination for COVID-19 is voluntary. And we encourage people to see the value of getting vaccinated. If me and you get vaccinated, then we'll be able to open up the economy and the social sectors. If some of us refuse to get vaccinated, we are going to be pulled backwards and we shall not open up the economy as we would want because there will be high risks of infection.
The call by the health minister comes on the back of concerns about a surge in the number of women contracting COVID-19 who seem to outnumber men, particularly in the hotspot areas of Teso and Chigezi sub-regions.
You may be aware that burials are mostly attended by females. The majority of those who go to pray are females, and of course they go along with the children. And some of this is causing what we see. But also in Teso sub-region, I am informed that the drinking of ajono is participatory, both male and female. And so that can explain to you why we are seeing more females and actually children coming in.
We've not been pushing people hard to get vaccines. And I think that is something to be considered. I'll tell you that in some of the European cities, you cannot enter some public space if you are not vaccinated. And maybe those requirements might become mandatory as we go ahead.
But the situation may soon change as the ministry is now planning to put more vaccination centers across the country to deal with the infections.
We plan to have vaccination points in places where there are large congregations, places that are having increased rates of transmission like the Teso sub-region.
The ministry has also warned patients and health workers on the risk of mixing and matching COVID-19 vaccines.
There is only one mix and match which is proven to be useful. The rest we don't have data to advise on, and that is AstraZeneca first dose followed by Pfizer second dose.
According to the latest statistics from the Ministry of Health, today is the first time the sector has not witnessed a death from COVID-19 for more than 3 months. The statistics also show that 56 people tested positive for COVID-19 today, down from 72 the day before. Some 2,378,171 people have received at least one jab of the COVID-19 vaccine. Of these, health workers form 34.3%, security personnel 19.4%, teachers 14.9%, the elderly 1.7%, and people with comorbidities 1.8%.